being urged to adopt to combat alcohol abuse.
There's no denying that alcohol abuse is taxing on the community, and it's confronting scenes such as these that's led to calls for increasing the tax on drinks. St Vincent's Health says it's time for a national strategy.
1 in 10 to 1 in 12 emergency department admissions are because of alcohol-related disease or alcohol-related injury.
The health providers released an election wish list with a variety of measures to cut alcohol-related harm by 20% within 10 years. They want the next government to crack down on consumption by adding graphic health warnings, restricting trading hours and ending all alcohol advertising on free-to-air TV.
It would be about policing those certain areas that we know are at higher risk, so the things that we can control.
St Vincent says enforcing the measures could prevent 30,000 hospital admissions per year and 3 deaths per day. They want to introduce a minimum price for alcohol and taxes based on volume, and with the money raised, end alcohol-related sponsorship of sporting teams.
And it's quite jarring to see a 10-year-old with alcohol-related advertising on their chest.
The report also calls for the introduction of Sydney's controversial lockout laws across the country, and that's supported by the Australian Medical Association. The AMA says there's strong evidence to show a link between a community's access to alcohol and levels of violence within that community. While the reforms in Sydney have led to a reduction in alcohol-related violence, they've also prompted widespread protests and a significant downturn in trade.
We're talking about retail stores, restaurants closing down, the whole city's vibrancy and reputation. I don't think it's good to only listen to a single voice here. We need to get everyone round a table and talking about the best way forward.
That way forward will become clearer after the election. Ashley Steele, SBS.